Fuck you. Dang, 3. That's good. Fucking hit yourself. Close. Dude. Fuck you. Fucking with me. Bro, no way, I fucking got that. Whoa. Oh, fuck. fuck do I turn off my mic for a second?
to teleport to another orange one. That's fine.
Yeah. I'm playing FF12 right now. Why? Really? You don't like it? I get you completely. Did I stutter that bad, bro? That sucks for you, man. I'm sorry. Alright then. I don't know. Nobody knows really what they got. Maybe because he knew he was being a fucking retard, I guess. I don't know. Do you know that guy? Yeah. That's what I'm doing, just chilling out. What else can you do right now? You been what? Oh, Convirus? Yeah, dude. Who knows? Maybe. Probably. Most likely, like, dude, most likely it'll just go away, or like you'll get it or whatever, and you just have to feel like shit, like. Bro, it's all fucked up right now. it's all fucked up right now with this stupid Corona thing, cause it's like it is serious, but it's not at the same time, cause it's not that serious yet. But you never know. Just I gotta like, you can't. What do you mean? Are you talking about the one party that's always in KH? It's like called Chill Party, and it's got like XO. I don't know what the fuck that is. I never even joined that party. I saw it said they said, I know it wasn't chill because they were like oh, chill party 420, pills and like I'm like XO. I'm like what? I'm like I already done it, dude. Like I don't need to talk about pills. Yeah. No, I mean, I just don't want to talk about specifically pills. That's why I never join it. Alright, what have you been... What have you been playing? Yeah, I saw it was free. I definitely picked it up. Really, it was good. I never played the original one though, so I don't know. Oh really? It's pretty good. Wow. Yeah, they're like big puzzles, right? Oh no. That's fucked. What up, bro?
Yeah.
There you go. Fuck. There's always those bosses in video games like you remember, like iconic ones, like even if they're not the final ones, you know what I mean? Like like if you play God of War 1, right? This boss wasn't that hard or anything, but if you play God of War 1, the first boss with the serpents, like the snake heads, dude, on the boat. Yeah, whatever, you just know that boss is like, alright, right. Yeah, fuck that boss, yo. Yeah, you fight it on the ship, it's like right in the beginning. And then and Zeus is like another boss, I'd say, in fucking God of War, like two or three or some shit. And then you got Seymour from FF10. And you got shit like that too, where he's not a final boss. It's mainly who you're stuck at. Yeah, you're right though about that. Oh really? Interesting. I wonder why they would do that though. Oh well.
You can just run. Limb. Heavy rain.
Is it good? I never played it.
Yeah, it's pretty good. I like it.
Is it one of those like Telltale games where you like select what your character's gonna do, or is it like a get out of the room thing? Because I don't really enjoy those types. I do like pushing buttons at the right time. That's fun, but I don't selecting dialogues. Yeah. The child? Doesn't like a child get raped or something like that? Killed or something? Well, I mean, I don't know, you can spoil me, but I don't know if this guy is...
No, you're good, you're good. I've played it already, I'm just like, playing it a second, man. Yeah. Probably. I'm pretty sure it's just supported. Yeah.
I mean, I always want a fancy shower though. Fuck that. Yeah. Oh, the kid? Oh shit, that sucks though, bro.
Yeah. Wait, is it? I'll be right. I'll be right. That's just like game. Sorry. What? Story game.
Oh shit, I've heard of it, never played it either though.
Matthew.
Sure. Yeah.
Oh yeah,
I have it, yeah. No, I played a lot of big maps.
Why are you bothering me? Why are you bothering me? Go somewhere. You're annoying. No, you're good. Go somewhere.
Yes, I can.
Go somewhere.
I can't.
Why are you acting?
Actually, get off the game. I want an hour.
What?
I want an hour to the
Oh,
game.
I don't know why you acting like my dad, but you might. Go somewhere. Why are you acting?
Mom, can I play the game?
I will play something.
Either you explain it.
It's funny.
Okay, well now you give me a countdown like you're my dad. Go somewhere. Stop talking. No. Are you?
I don't have a brother, so I never had to deal with any of that.
Yeah, that's younger. He's just doing it to bother me. Yeah. I'm not wanting to control this house. Do you play for trophies or just to play games? I said, do you play for trophies or just to play the games? Yeah. Gotcha. You play for the story? You play for the story? Yeah. Gotcha. Uh-huh. Yeah. Is it a good game? Is it a good game? I'm a good game.
What are you doing? Why you do?
Gotcha.
What?
How long does it take to play? Or be done? Yeah.
Shit. Fucking monkey balls. Yeah. If you know what you're doing.
Wouldn't it be more fun to do it the hard way though? Like I just feel more reward.
Bro, I'm just in the beginning. This shit is gonna take forever. I played. What do you mean? No, you can't turn off the lines. Oh wait, hold on. You might be able to. Hold on. Yeah, you can. He's not lying. Yeah, my bad. Target lines, right? That's what they would be called. I turned them off. That makes you feel a lot better. It would probably look a lot better, honestly. You're right, though. Now those lines kind of suck, man. But you know, if you're how would you know what you're about to attack? Then you got to remember everybody's attacks, I guess. What other way would you use for this type of combat system? You know. Well, then you'd have. Yeah, but this is like, not really. You kind of, you know, you can't really change the system. Yeah, no, I know you get it. I'm just saying, like. If you went to ATB though, for say, right, it would have to be like almost turn-based where you guys can't move your character. You know what I mean? Oh no, I'm not like, disagreeing with that at all, though. You know, but. I don't even know. That was a crazy ass battle system, bro. That shit was ridiculous. Love Vanille. Vanille was broken. Who else? Even Lightning was kind of broken. Snow was the worst one. I'm gonna be real. Fang. Yo, Fang was good. Could she really? Like, this is endgame like stuff, or like? Yeah. Yeah. Yeah, I know what attack you're talking about. It's, yeah, I know exactly which attack. I was working. I was trying to get to that point where I could unlock that shit for her. I was trying to get the platinum, but my account. I know. No, there's like, I know what you mean. There's like hidden abilities and like shit within the abilities. Yeah, it's like they never show it. They never show those abilities. It's bullshit. Oh, you're right. Under like the armor area or something, probably. Yeah. You need to have like 2 Ravagers and a Commando or whatever it may be. Shit's crazy. Guess not. Maybe. I think I started using that attack towards like the end as well. Like you could use that attack. Oh, I have that actually. I have that attack. I was taking out adamantoids with it and farming them. Yeah. Yeah, dude. Those were crazy ass adamantoids for one of. Yeah, you can't kill this fucking thing. Like, this thing is fucking ridiculous. Yo, those adamantoids were ridiculous looking, bro. Oh, right before Orphan. Why'd you think that was stupid? I knew they were gonna do that. I didn't mind it, actually. I didn't care. That's funny, though. In the fucking city, yo. In the fucking middle of the city, yo. In the middle, I know, like, literally, like, on the front steps of the fucking palace type of thing. Like, you're about to... It's just fucking huge-ass elephant thing. Like, this thing is, like... This thing's not even an elephant. This shit is a fucking, like, long-necked dinosaur. I don't know. Okay. Shit. Oh, bro, this game is great though. It is. It really is. But like a bit like. If you want to play it together, but the thing is, I'm gonna go for the platinum like I always do with every fucking thing. Like, even though I don't get it or not, I start off, usually when I dedicate a game, I'm gonna go for it. You know what I'm saying? Like, Kingdom Hearts, whatever. Like, I'm really close to the whole platinum with the... No, that's what I was about to just say. I'm really close. I need, like, a little bit more things to do. I can't wait to get... I'm gonna get it, yo. I'm fucking gonna. Oh, really? That shit is tough. But sometimes you need a break. It's not that tough. It's time consuming. Yeah. Oh, man. Yeah. Oh, that was one of my favorite parts. I didn't mind the ice cream. Yeah, I know. I didn't mind that. I am sure they did. I don't think I've ever failed one of those ice cream things ever. Like, I'm just amazing at rhythm games. It's just, I don't know why, how, whatever. But I am. Like, I don't have I understand why some people would have a problem. It's kind of like a Guitar Hero thing. Like, some people just can't do it. Yeah, I have a harder time in fucking Atlantica than ice cream. For what? What the fuck? No, not worth it at all, bro. I got this shit for like 20 bucks. What the fuck? No. Or do you have game stores near you or anything like? Yeah, I know what you mean. Like, bro, honestly, fucking America's just being like a bunch of fucking crazy people right now. Like, yeah, everybody's good. You can go anywhere here, but like, they kind of like look down upon you if you're doing that, though. Kind of. They're like, dude, you shouldn't be out. I'm like, yeah, fuck you. Yeah. Yeah, it doesn't. I know. That's it. I know, bro. Like either like places are flooded, like this, like grocery stores and shit are flooded. Yeah, and then like during the day everything is like eerily quiet, and like if you see yeah, like, if you see people though, like nobody speaks to each other. They're just like, all right, we gotta. Yeah. Fuck, dude, Fallen Jedi is fun and all, but I have fucking, what the hell, I just got a trophy. Oh, okay. I got fucking, what was I gonna say now? Shit. What game were you gonna get? Oh yeah, Fallen Jedi. I have it, yeah, right? But when I put it in the game, like, you need a PS4 Pro kind of for it. That's what I was gonna say. It's very fucking glitchy on the regular one, bro. Yeah, like I'll be moving the camera and I know you'll be pissed off once you see, like when you move the camera, like shit will take like a second, not even like half a sec. It'll take like a second to load in, you know what I mean, like the pictures, and it'll be like a choppy camera movement as well. So it'll be a choppy camera movement, and like shit takes like a second for it to load in. It's fucking ridiculous. No, the game is awesome and combat's fun, but like there's like a delay sometimes when it's lagging. You're like, bro. It's fucking ridiculous. That too is just as bad, but I'm saying while you're even in the game as well. Not even the load, like, it's crazy. Crazy. I'm just saying beware. No, I'm just saying like beware. It's not the best game ever because of that dumb shit. It could be very good, but you know. That's re- Yeah. I'm gonna play it. Definitely, not today or anything. I might play it today, but maybe, I don't know. I don't know yet. We'll see how the night goes. Oh no, I know they don't, bro. 100%. I know that for a fact. I don't know, some games I do need a story in some games though. You know what I mean? Like usually when games are, alright, so like usually when games don't have a story, they're kind of like a side game to me. Go fuck shit up. What's up, Solo? What up? Nice. Your mic is cutting out, not ours. Dang. I just used like a $5 headphone thing. You said nah. Nah, you said nah. Fuck. My Vaughn is level 1 and my Pinello is level 50 right now. It's definitely Vaughn. They say Vaughn in the game, bro. Yeah, did Solo leave? I forget who left. I didn't even see. For real. Hold on one sec. You need help?
No.
Yo, I'll be right back. I gotta take a leak.
You want a chair with my meal?
Where'd you go?
I went to Walmart. No, I went to ShopRite.
Is there people there?
Huh?
There's people there?
No.
They got masks or anything like that?
No, nobody's there right now. No water.
Yeah, of course there's no water.
No toilet paper.
Water you fucking need.
No, I don't need
They're not you, but like people. Like, come on, guys.
I think I want to take to my friends. This is one of my friends upstairs. I don't need. No. I don't need. No. I think I here. Try some these. Yeah, it's insane. The whole thing is insane.
Corona?
Oh my God. Yes, sure. That's lame.
Lane?
Yeah.
What's the lane?
Me.
Lane?
Lame.
Lane. What's lane?
Me, stupid.
How is it lane?
Lame.
How old are you?
What is stupid and
Yeah, whatever.
Shenyun. Discover why people are calling Shenyun.
Can you still go to that?
A pleasure to the ear. An epic tale.
Delayed because of the
A
corona.
must see. New York-based Shen Yu comes to New Jersey Performing Arts Center, April 23rd through the 29th. ShenYu.com/NJ.
I'm Nick Valencia at Atlanta's International Airport, and this is CNN.
Closed captioning brought to you by 1-800-PET-MEDS. Call or visit petmeds.com to save big today.
Rely on the experts at 1-800-PET-MEDS for the same medications as the vet, but up to 30% less. With fast free shipping. Visit petmeds.com today.
This is CNN Breaking News.
Welcome to our viewers here in the United States and around the world. I'm Wolf Blitzer. This is a special edition of the Situation Room. We're following breaking news. The White House Coronavirus Task Force is preparing for a press briefing set to start at any moment. You're looking at live
bone
in the
on
briefing
here.
room. The Vice President Mike Pence and
bone.
others
This is a
are
fucking
expected
bone.
to give an update on the federal
get this?
government's response to the coronavirus. We're going to have live coverage
made
as soon
this?
as it begins. We'll see if the President shows up
Why?
as well.
Why?
It
I don't
comes
know.
as we see the
I don't
number
like
of
this
cases
shit.
spreading across the United States. Now over 3,300 reported.
Like 5 fucking bones in
63
each.
deaths.
No.
Meanwhile, the White House is imposing new travel restrictions on the UK and Ireland tomorrow. That's on top of current constraints already in place for much of Europe, which has become the epicenter for the coronavirus pandemic. Right now, airports across the United States are facing huge delays, a long line, some hours and hours long.
Not
Three
really.
Americans being screened before re-entering the United States and being allowed to go through customs. Let's begin our coverage right now with the latest efforts of the Trump administration to manage this growing crisis. CNN's Jeremy Diamond is over at the White House for us, awaiting the start of the coronavirus briefing. So, Jeremy, what are we expecting to hear?
Well, Wolf, we're already seeing over the weekend the impacts on Americans' daily lives really rippling across the country and really being exacerbated. And that is why there are these more and more questions at the White House about what exactly this administration is going to do to encourage or more explicitly require Americans to practice that social distancing that we have been hearing so much about for the last several days. There are active discussions at the White House, I'm told, about ways in which the administration could do that, but there is not serious consideration at this point yet about effectively mandating some kind of a national lockdown. Questions about that, though, arose this morning after the Dr. Anthony Fauci, one of the top public health officials in this government, suggested that he would like to see more active, more serious efforts from this administration to encourage that social distancing, and he did not rule out the possibility of a national lockdown. Well, with all of this coming, as we are seeing really states and local officials, they so far have been taking the lead on putting those types of restrictions in place. We just saw the governor of Illinois announce that restaurants and bars would be closed to the public. So again, these are steps that we are seeing local and state officials taking. The question now is, what will the federal government do on that front? And frankly, Wolf, beyond simply the actual policy implications of this, there is a question about the messaging from this White House. Can they provide that more concerted messaging about what Americans should do in their daily lives, the kinds of changes that they should implement to really mitigate the spread of this virus?
All right, it's a serious issue, Jeremy. I know we're told now it's about to begin the briefing. We're waiting for that briefing to begin. I want to bring in, as we await the briefing to begin, we're told there's that 2-minute warning. Dr. Zeke Emanuel is with us right here in the Situation Room. Dennis Carroll is with us as well, infectious disease expert, former director of the USAID's Emerging Threats Division. What specifically, Zeke, do you think we need to hear from the task force right now?
We need to hear more about how they're planning to do social distancing and how they're planning to enforce that. It's quite clear that the big spread is not people coming from Europe, although allowing people coming from England, if you're locking down the rest of Europe, doesn't make a lot of sense. But we do need, it's community spread inside and what they're going to recommend. Are they going to leave it to states and localities? Some are doing really great. And we see that in, I would mention, Mike DeWine in Ohio, who you had on the show a number of times, has really done a great job. The mayor of Hoboken in New Jersey has done a great job. But there are some states that are doing almost nothing. Think of Texas. Think of Georgia. We need a concerted, consistent message. Otherwise, we have social distancing working in some places, and then in other places the virus is just going to spread. So you'll never get your arms around it, and we can't get the economy going until we get our arms around it.
What do you think, Dennis? What do you need to hear right now?
Well, Wolf, we've seen great leadership coming out of states and the private sector. Last week, the NBA and all of the different sports community shutting down operations, a real shot across the bow in terms of the importance of social distancing. I think it was a real wake-up call. We need to see the federal government really provide a national level sort of signal. How are we going to promote this in an evidence-based way?
Well, let me bring in Dr. Seema Yasmin. She's a CNN medical analyst who's helping us better appreciate what's going on, the director of Stanford University's Health Communication Initiative. Seema, how do you see this unfolding right now? Because what we heard from Dr. Fauci, a man you know well, earlier today was so disturbing, saying that potentially, and let's hope it doesn't happen, 100,000 people potentially could be at risk right now.
Really sobering numbers, Wolf, coming from a man who's careful about his communication and really careful about not panicking the public. But here we are, 45 days into the World Health Organization's public health emergency declaration. We've seen the U.S. response be slow, be blundered. We are not seeing clear and consistent messaging from officials here. You know, I can tell you, having worked at the CDC, there's a manual that's about 450 pages long about how you communicate during public health crises like these ones. And we're not seeing that happen right now. The public is confused and perplexed, and we're now talking about longer and longer periods of these disruptions to daily life precisely because this was not acted on early enough and not quickly enough. Time is of the essence during an epidemic investigation, Wolf. Sadly, time has been squandered here.
Let me get Elizabeth Cohen in on this conversation as we await the start of this briefing. Elizabeth, you speak to these medical professionals all the time. What do they want to hear?
What they want to hear is we are going to have tests that will be so widely available that it will be like ordering a flu test or any other test that we can order so easily. That's what they want to hear. They also want to know how they're going to be protected. Right now, there's some confusion. Do they have to wear N95 respirators? Is a surgical mask okay? And if we're saying a surgical mask okay, is that just because we don't have enough N95s, but really N95s are better? I think there's a lot of questions about how they can protect their patients and how they can protect themselves.
You know, Zeke, so far, you know, what's going on in Europe right now, Italy and Spain and elsewhere, is of deep concern to folks here in the United States, because a week from now, 2 weeks from now, Americans may be going through those kinds of procedures.
Yeah, that's our future unless we act. And even if we act now, I mean, we really have probably till April 1st. I mean, if you look at some of the modeling, April 1st you can keep the total number of cases down under 1 million and the number of deaths under 100,000, closer to 60,000. But that requires a very aggressive move between now and then. And one of the things we have not seen from this administration are aggressive, concerted moves. And I think we need to have a lot more forward leadership, which they haven't done.
How serious, Dennis, is this crisis right now?
Well, I think, you know, we can look at Italy right now, and you can see an extraordinary surge in the number of deaths just in the last 24 hours. 360 people died over the last 24-hour period, and it's only accelerating. We're not seeing any shift in the epidemiologic curve in Italy at this point. We should be taking every step we can to have as forward-leaning, aggressive policy as possible. And the only real tool we have at our disposal right now is social distancing. We need to exploit that to the maximum.
It's important, Wolf, just to mention, we say 300 and some odd deaths overnight. You know, that probably means 250,000 infected people that we're not detecting. And because you multiply each death by about 800 to get the total number of people out in the country. So Italy has got, you know, probably more than 1 million people infected already. And that is, I think, what we have to be seriously concerned about. Even if the death rate is 1%, that's a huge number.
Yeah. All right, hold on for one moment. As we await the start of this briefing, we have some breaking news coming into the Situation Room from the Federal Reserve right now. We're learning that interest rates are about to be slashed to zero. CNN's Ron Brownstein, one of our analysts, is standing by. This is what the president presumably wanted to hear, Ron.
Absolutely. Look, I mean, some of the forecasts that have come out in the last couple of days from the various economic forecasts, I saw one from Goldman Sachs,
I don't have any money,
are pretty apocalyptic about the second quarter economic situation. And I would add parenthetically that political science modelers through the years have noted that the second quarter of the election year is the one most important in shaping voters' perceptions of the economy on election day. So absolutely,
help me out about
what the president wants. We'll see, you know, how much impact it can have, given, as the president has often talked about, the consumer is such a driver of the American economy. And in fact, the consumer has been driving the economy much more than the business investment that he touted with the tax cut. And if people are staying at home, I mean, they can order on Amazon and, you know, other online services, but there's no question every forecast has the economy taking a significant hit in the second quarter.
And the president, Ron, as you and our viewers know, he's not been shy at all over these past several months in criticizing the chairman of the Federal Reserve for having what the president regards as too high interest rates.
Right, the tight money policy. You know, it was interesting today in that NBC Wall Street Journal poll that came out, that while most of it was kind of steady as she goes in terms of the president's approval and the country dividing in predictable ways and whether he was handling the coronavirus outbreak effectively, well, there was a noted dip for the first time in quite a while in economic optimism about the coming months. And, you know, certainly the president is enormously sensitive to that. He has used the stock market since day one, even though only a certain portion of Americans are in the stock market, as kind of a principal gauge of his economic success. Most of the gains of his presidency have now been washed away. So if the cut in interest rates, beyond spurring broader economic activity, if it just generates a stock market rally, I think he will view that as a success.
Yeah, and a lot of the president, Ron, obviously pays enormous amount of attention to numbers, especially the stock market and other numbers, unemployment right now, stuff like that. So presumably, I assume he thinks the reaction on the markets tomorrow will be positive to this news from the Federal Reserve.
Right, and as I said, I mean, even if it does not, you know, radiate out immediately into the broader economy, given the extraordinary headwind of people being reluctant to be out, you know, anywhere where they might be encountering other people, if it does produce a market rally, I think he will, you know, he will view that as he has framed the stock market gains as such an important measure of the success of his presidency that you know, it carries an outsized importance to him beyond his actual impact in the day-to-day economic kind of situation in the country. And look, I mean, you know, one thing that's really striking, Wolf, about these last couple of weeks is the extent to which even a pandemic is filtering through the red-blue divide. I mean, look at the polling today, not on the reaction which you would expect dividing along partisan lines about how President Trump has handled this, but the reaction, the gulf between Republicans and Democrats on whether they are taking this seriously, whether they are less likely to go to a restaurant or less likely to be in go to a large gathering. I mean, we're talking about twice as many Democrats or more as self-identified Republicans saying that they are basically changing the way they are acting as a result of this. And that's, you know, I think that is largely a function of both of the signals from the president and other Republican elected officials, but also from the kind of the conservative information system. So even in a pandemic at the moment, we are living in separate realities. The place where it may come together, though, is the economy. And as I say, that is what the polling kind of showed right away, and almost more concern about the economic impact at this point than the public health impact, which in you know, many parts of the country where may seem more theoretical at this point than immediate, although given the trajectory in Italy and other countries, obviously that could change very quickly.
Yeah, we're seeing some of the folks start arriving. Ambassador Birx is there. Looks like some military personnel are there as well. We'll see what the announcement is going to be. We expect the Vice President, Mike Pence, to walk in. We were told a few moments ago, but he should be walking in momentarily, and we'll see what they have to announce. The Vice President said yesterday they would be making some significant announcements in the course of today's briefing over at the White House. We'll see what they have to say. Quick question to you, Dr. Seema Yasmin. The president, he did take the coronavirus test, came back negative. The Vice President hasn't taken the test. Who should take the test and who shouldn't?
So we know it depends so much, though, Wolf, on the actual availability of testing. So it's a bit of an academic question, unfortunately. To briefly answer it, you take the test if you feel like you've been exposed to somebody who had confirmed COVID-19. What I'm still hearing as of today, my phone is blowing up from doctors and nurses across the United States who say, where are these tests? You're reporting that the politicians are saying there'll be 1.5 million available this week. We are not able to get them for our sickest patients who we want to differentiate as having COVID-19 and not the flu. So this is still an issue, and I hope that in the midst of these very big decisions...
All right, stand by. The
that
president, as we anticipated, is here.
And I think we have some great things to talk about. I'll start by discussing the Federal Reserve. As you know, it just happened minutes ago, but to me it makes me very happy. And I want to congratulate the Federal Reserve. For starters, they've lowered the Fed rate from what it was, which was 1 to 1.25, and it's been lowered down to 0 to 0.25, 4.25. So it's 0 to 0.25. That's a big difference. It's quite a bit, about a point. And in addition, very importantly, the Federal Reserve is going to be purchasing $500 billion of treasuries and $200 billion of mortgage-backed securities, and that number can increase. But they're going to start with that, and that's really good news. It's really great for our country. It's something that we're very happy. I have to say this. I'm very happy. And they did it in one step. They didn't do it in 4 steps over a long period of time. They did it in one step, and I think that people in the market should be very thrilled, and that brings us we're the strongest country in the world by far, financially and every other way, and that brings us in line with what other countries are. They actually have negative rates, but look, we got it down to potentially 0. So that's a big step, and I'm very happy they did it. And you will not hear anything bad about me unless it's about a month or 2 from now. So I congratulate the Federal Reserve. I think it's terrific. Just came out just as we spoke. I wasn't going to mention Federal Reserve or anything else, but this came out as we were walking up. I want to thank the people at Google and Google Communications, because as you know, they substantiated what I said on Friday. The head of Google, who's a great gentleman, called us, and he apologized. I don't know where the press got their fake news, but they got it someplace. But as you know, this is from Google. They put out a release, and you guys can figure it out yourselves and how that got out. I'm sure you'll apologize, but it would be great if we could really give the news correctly. It would be so wonderful. I just had a phone call with very impressive people, the biggest in the world of stores and groceries and all, and I'll give you the names. Dave Clark, Whole Foods; Mark Clow, CEO of Campbell's Soup Company; Brian Cornell, CEO of Target; Randy Edeker, Chairman and CEO, President of Hy-Vee; Jeff Hamerning, CEO of General Mills, great company; Kevin Burakan, President and CEO of Cisco; Greg Jelinek, CEO of Costco; Todd Jones, CEO of Publix Supermarkets; Donnie King, Tyson Foods; David McLennan, Chairman and CEO of Cargill; Rodney McMullen, CEO, Chairman of Kroger, big company; Doug McMillan, CEO of Walmart. He's been fantastic. Doug was here, as you know, on Friday, and he watched the market go up 2,000 points. On Friday, it went up 2,000, almost 2,000 points. Todd Vasso, CEO of Dollar General Corporation, and Vivek Sankaran, President and CEO of Albertsons. So these are all phenomenal companies. These are great companies. We had a long conversation with them, and they're going to work 24 hours round the clock, keeping their stores stocked. I would like to say that people shouldn't go out and buy. We're going to all be great. We're going to be so good. We're going to do what's happened with the Fed is phenomenal news. What's happening with all of these incredible companies is phenomenal news. But you don't have to buy so much. Take it easy. Just relax. People are going in and they're buying more. I remember, I guess during the conversation, Doug of Walmart said that they're buying more than they buy at Christmas. Relax. We're doing great. It all will pass. The folks that we spoke to, they've done a fantastic job. They're going to meet the needs of the public. They're going round the clock if they have to, and they're committed to the communities where they're serving and which they serve so beautifully and have for a long time. And they're buying a lot of additional things to sell. But again, they actually have asked me to say, could you buy a little bit less, please? I thought I'd never hear that from a retailer. All of them are working hand in hand with the federal government as well as the state and local leaders to ensure food and essentials are constantly available, and they'll do it. There's no shortages. We have no shortages other than people are buying anywhere from 3 to 5 times what they would normally buy. It's going to be there for a long time. We're doing numbers, and there's a pent-up demand that's incredible. When this passes, when this goes through, you're going to see numbers, I predict. I guess I'm allowed to predict just like Wall Street people are allowed to predict, and they're pretty much in agreement. You're going to see there's a pent-up demand like a lot of people, including me, haven't seen before. But this has to get through. They know they're getting through the crisis and will require an all-of-America approach, and that's very important. They're committed to remaining open during this crisis, totally open. They have to stay open. Those stores have to stay open. They supply our country. Our supply chains in America are the most powerful in the world, and they're all working very hard. They're working around the clock, and the stores are stocking up at a level that's beyond Christmas time, and it's great. It was very reassuring speaking to these people. They have it totally in hand. There's no need for anybody in the country to hoard essential food supplies. They said to me, could you please tell them, just go and buy, enjoy it, have a nice dinner, relax, because there's plenty, but you don't have to buy the quantities because it's hard to refill the stores on a basis as rapid as they're refilling them. And we're using the full power of the federal government to defeat the coronavirus, and we will do whatever it takes, and we're doing, I think, really, really well. A lot of good things are going to happen. I want to thank all of the people standing behind me. You know, these are phenomenal people, and we have some of them right over here, but the people behind me have been working round the clock, and they're doing an incredible job. We see what's happening. We see what's going on in other countries. We're looking we're learning from watching other countries, frankly. There's a very contagious virus. It's incredible, but it's something that we have tremendous control of. I think very important to young people, people of good health, and groups of people just are not strongly affected. Elderly people that are not well or not well in certain respects are really a dangerous group. We have to watch them. We have to protect them very much. We have to really watch over them and protect them because they are very vulnerable. And with that, if it's okay, I'm just going to go and make some calls. I'm talking about Federal Reserve. I think it's a tremendous thing that took place just now. I didn't know I would be surprised on a Sunday. I don't know if that's ever happened on a Sunday before, but I would think there are a lot of people on Wall Street that are very happy, and I can tell you that I'm very happy. I didn't expect this, and I like being surprised. So our Vice President, who's doing an incredible job, is going to take over, and I will see you probably tomorrow. Thank you very much.
Thank you, Mr. President, and good afternoon. With more than 2,900 cases of coronavirus in 49 states across the country, I want to assure the American people that this administration, all of our partners at the state level, and local health officials have no higher priority than the health and safety of the American public. And at the President's direction, we will continue not only a whole-of-government approach, but as we'll discuss today, we'll continue to build on a whole-of-America approach to confront the coronavirus across the country. The health experts continue to confirm to us that based on the latest information, for the American people as a whole, the risk of serious illness remains low. But because the risk is heavily weighted to the most vulnerable, to people with immunodeficiencies and to people who are elderly with serious underlying chronic health conditions, our administration, and I know state administrations, will continue to focus on the most vulnerable, and we will continue to urge every American to be vigilant in practicing good hygiene, taking the advice of the CDC and local health experts to keep those most vulnerable safe. I know I speak on behalf of the President and our entire team when I say how grateful we are for governors all across the country and the seamless partnership that we have with them and with state health officials, with our federal team. I spoke today to Governor Pritzker of Illinois, and we are in continuous communication with governors a phone call away. They know that they can contact us and address even the smallest need. Because as a former governor, I know firsthand that when it comes to health challenges in America, our states are on the ground in the lead, our local health organizations, and we've built a great partnership. We also want to express great appreciation to the American people. Not surprisingly, it is inspiring to see the way tens of millions of Americans are responding with compassion, with common sense. And we want to express particular gratitude to communities of faith that participated in today's National Day of Prayer. We've seen places of worship implementing policies to keep those most vulnerable safe, and also we're seeing communities of faith already stepping forward to support and to encourage those most vulnerable. I heard tell of a church back in Indiana that's actually no longer having services till April 10th, but in the meantime they'll be offering daycare to the children of healthcare workers in central Indiana. And churches all across the country are taking the opportunity to reach out and put feet on their faith, and it's truly inspiring. As President mentioned today, he spoke today to leaders in the grocery store industry and where people buy our food, and we heard and we're reminded that America has the most efficient and effective supply chain in the world, and it's working just fine. As the President said, he received a commitment from those grocery store executives that stores will stay open throughout the days that lie ahead. We were told that hours may be reduced to allow for cleaning and to resupply, but American families can be confident your local grocery store is going to be open, it's going to be well supplied, and they specifically asked us to encourage Americans, just buy your weekly needs in grocery, because the grocery stores will remain open. Also, very movingly, those same executives all reiterated their commitment to continue to support local food banks in the way that our grocers continue to do around America. Tomorrow, the President and I will be briefing all the nation's governors, states and territories, and the District of Columbia. We'll be speaking about the progress that we're making, and we'll be speaking to them specifically about our widening partnership on expanding testing to the American people. So allow me to speak to that issue, and then I'm going to recognize Admiral Brett Guar, who will describe for us the excellent work the Public Health Service is doing. Dr. Birx will describe the importance of the new national public-private partnership for diagnostic testing that is going to open the door to thousands of more tests in real time for the American people in the days ahead. First, some fundamentals. As the American people know, testing is now available in all 50 states. Either state labs are either conducting the tests themselves or the CDC is processing tests. They're using the traditional manner of a manual test that allows for 40 to 60 tests a day. It is among the reasons why the President several weeks ago tasked this group at the White House to reach out to commercial labs around the country and forge that public-private partnership that would bring the the high speed, or more accurately, the high throughput testing for coronavirus available in real time. And based on the unprecedented speed of the FDA, which last week approved high throughput coronavirus testings for Roche and Thermo Fisher, we will now have access in the days ahead to more than 2,000 labs across the country that have the equipment today to process coronavirus tests much more rapidly and a much higher volume for the American people. In terms of delivering those services, more than 10 states, in addition to CDC labs, and public health labs, and labs that states can now authorize in their states, more than 10 states have implemented their own drive-through testing sites, and we want to commend New York, Colorado, Delaware, Washington State, Texas, and others that have implemented these on-site places where people can obtain tests. Most are using the current CDC testing, manual testing, but we are working closely with our governors, as you will hear momentarily, to make sure that the new testing regimen is available for their remote sites as well. As I mentioned, as of Monday, we will have more than 2,000 labs coming online with the high-speed testing, and we are connecting states to those testing methods. We're also working with a number of retail partners to add to the work that states are doing around the country, working to set up parking lot testing centers outside of stores, and Admiral Brett Garrar will detail the progress that we've made over the last 72 hours. Following the President's declaration of emergency, the Admiral and our Public Health Service have forged a partnership now with FEMA, made possible by that declaration, and they've reached out to all 50 states to create a process that will enable all Americans who need to be tested to go to a community-based testing site outside of usual healthcare facilities. The focus of these tests, as Dr. Birx will describe momentarily, will be on those most in need. A priority will be placed on healthcare workers and first responders who are out there coming alongside people that are being impacted by the coronavirus. We want to make sure they have access to the testing as a priority. And then Americans 65 or over with a cough or a fever or other symptoms will be prioritized over other tests that are extended. As I mentioned, Admiral Garrar will describe the progress that we've made in just a few moments, but we're going to continue to work very diligently, hour by hour, day by day in the days ahead, to expand testing around the country and access to this extraordinary and unprecedented national public-private partnership for diagnostic testing. With regard to testing, as we expand testing, we're so pleased that Congress joined with our administration to make sure that cost is never going to be a barrier to anyone getting a coronavirus test. As you recall, several weeks ago, the President directed a change in our Medicare and Medicaid programs to ensure that coronavirus testing was included. Health insurers were brought in. They all agreed to waive co-pays, but because of the good bipartisan work done in the House of Representatives, now all coronavirus testing is free, and it's free for every American, including uninsured Americans. And we continue to urge passage of the legislation that will be considered by the Senate this week. Let me say one final word about the testing issue. And that is that we, as the President often says, we're all in this together. And it's absolutely important that as we expand testing resources across the country, beginning by prioritizing the areas that CDC and our state leadership tell us are most important. It's important that the tests are available for people that are most in need, and for our healthcare workers and first responders that are helping them and supporting them. As Dr. Birx will describe, the testing that is available should only be done if for any reason you think you may have the coronavirus. We encourage people to consult their doctor, and if you're symptom-free, we encourage you to work with us to make sure the testing is available for people that are experiencing symptoms. It's extremely important that we have the continuing cooperation of every American as we expand testing and make it available during this challenging time in the life of our nation. With that, I'm going to ask Dr. Burks, I'm going to ask Admiral Brett Giroir, the Public Health Service, and the leader of this great commission corps behind me, to come up and describe the extraordinary work that they have done over the last 72 hours and will be doing each and every day in conjunction with our states to expand testing to community-based testing across the country for the American people using this new public-private partnership diagnostic testing. Admiral?
Thank you, Mr. Vice President, and thank you for your personal interest and support of our team over the last 72 hours as we worked on this critically important project. So as the Vice President said, over the past 72 hours, we have developed and are beginning to implement now a process and a program of testing that will enable Americans who are in need of coronavirus testing to be tested effectively and efficiently according to a few principles. Number one, we want to assure that those most vulnerable and those impacted are able to be prioritized. Number two, we don't want to do testing that in any way threatens the acute care system. In other words, we don't want people going to hospitals and acute care clinics where, number one, they could infect other people or subject themselves to infections. And number three, we want to balance the needs across the entire healthcare system among diagnosis but also treatment. In other words, we want to balance the stress on the strategic national stockpile and all our commodities so that everyone gets all the materials they need. So what did we do? Because, as the Vice President said, last week's historically fast approval of high throughput testing, we are now in a new phase of testing. And you've heard Dr. Fauci talk about the new phase. So we're going from somewhat manual, relatively slow phases to a testing regimen that we can test many tens of thousands to hundreds of thousands of individuals per week and maybe even more. We will have 1.9 million of these high throughput tests available this week, with numerous labs, up to 2,000, starting to turn the lights on beginning this week and rolling out over the week. That is really a game changer for us because the back of the shop testing capability is there. The front of the shop is what we've been really working on. In order to get a test there, you've got to be able to swab individuals, get them into the system without completely paralyzing the entire healthcare system as we have. So with the emergency declaration, this was very, very important to us because it really enabled the historically effective processes of working and empowering states, federally supported state-led efforts through the normal FEMA mechanisms. So for the last 72 hours, representatives of FEMA from across the government and our commission corps have been working on joining the unique and unprecedented public health mission with the historically successful mission of personal distribution centers, places for distribution, the pod system of FEMA. Our public health service, we've already deployed over 1,000 officers in support of the coronavirus missions. That includes to the Diamond Princess, to the borders, to the quarantine stations, to the acute care settings where we're caring for nursing home residents in Seattle. So we have a very experienced group, and we brought these together. So what we've really designed and how we're working with the states, we have contacted all 50 states through the FEMA system, every single region, every single state, to understand where they are. As the Vice President said, some states are rolling out some of their own community-based testing. They need to be augmented. We believe we've created a model based on the public health and the FEMA system that is optimized, that can be used for drive-through or potentially walk-through. Each of these pod-based units, we believe, can screen 2,000 to 4,000 individuals a day for testing with all the appropriate personal protective gear, all the appropriate back end and linkage to the public health system, including testing. We know that we have the logistics to do that. We know we have the materials to do that. And again, this is federally supported, state-led efforts. Many states need the full meal deal. They want dozens or of public health service officers to work in protective gear to actually test. They need supplies like protective gear, they need swabs, they need logistical supports. Other states only need a fraction of that. They may have all the personnel, but they really need the know-how, the template, and some of the gear that we provide. We are going to start implementing this system this week in a number of states, primarily those that are the hardest hit right now or are on the rise, and the CDC has advises us that that's when they need the testing. I want to emphasize again that we're focusing on two very important groups, and you'll hear this said 3 or 4 different ways, and the groups that really can be the most impacted or impactful in our outbreak. Number one is healthcare workers and first responders. This is very important for 2 reasons. Number one, we have to take care of the healthcare workers and responders because when America needs them, they need to be available, healthy, to provide the care that we all deserve. But it's also important that if they feel they have a risk of having contacted coronavirus, that we test them so they cannot spread that, for example, in long-term care facilities where the elderly are. And the second group would be the elderly. And we are classifying that according to risk as those 65 years of age or older who have a respiratory symptom and a fever of 99.6. That's a lower number than you've seen before because those who are older do not spike high fevers like children do, 104, 105. So you set the bar just a little bit lower. We do that because we know that they are high risk of bad consequences, and if they test positive, they can engage with their practitioner, telehealth provider, or get in the system to make sure they have just an outstanding outcome. So that is really where we are. We've made really unprecedented progress. You will see these sites rolling out progressively over the week. This is not make-believe. This is not fantasy. We've developed the model. We've talked to the states. We're focusing on specific locations now. We will start shipping gear, stuff, tomorrow. We will start deploying officers tomorrow and Tuesday, and we'll begin seeing these sites, in addition to the ones that are springing up now, implemented during this week. We will have the capability of testing tens of thousands of additional people through these sites every week, in addition to all the capability that's now going to be distributed in the 2,000 laboratories in the major central core laboratories. And I know you have a number of questions that hopefully in the question and answer session we'll be able to answer for you. But I think this is just a great linkage. I'm a pediatric ICU doctor. I take care of sick people. I know what happens when you get respiratory illness. The Surgeon General is an anesthesiologist who takes care of people who have respiratory difficulties and manages that. So we know how this works. We've been there. The most important thing we've worked on right now is making testing accessible because of the advances of the FDA and private industry to make these high throughput tests. Now we can work on the front end with the emergency declaration. We have all the tools, and all of government has really come together with industry, not just government and states. It's really been private industry, the manufacturers to bring the swabs, the personal protective gear, the laboratory testing, the shipping, the fronts with Walgreens and Walmarts working as potential sites. This has been something in my mind has been unprecedented. The entire society approach working so intensely over the past, certainly over the past weeks, but incredibly on this project over the past 72 hours.
Thank you, Admiral. And let me say, we are moving out now that we have the public-private partnership with the major commercial labs. And now you have our public health team as well as FEMA moving out, connecting to the states to deploy these point-of-distribution community centers. We'll also be working closely with members of the media in individual jurisdictions, as well as we're working with Google and other tech companies to make sure that there's online resources where people will be able to readily access a questionnaire that will walk them through the symptoms and whether or not a test might be indicated. And also, in the days ahead, we look forward to that same website being able to direct people to the nearest community center or drive-through center that's available. But let me introduce Dr. Deborah Birx to speak about that patient experience and about the importance of the right people seeking the testing in the days ahead. Doctor?
Thank
Thank you. Thank you, Mr. Vice President. Let me just start by recognizing the men and women of the military who are serving us every day. They are my brothers and sisters. I was privileged to serve alongside them for quite a long time, but critically, I just want to recognize at this moment the Public Health Commission Corps behind me. The Vice President, although he didn't speak to this, actually went to see them yesterday at the place where they were working so that we wouldn't disturb them because of their level of dedication and work through the last really 48 hours nonstop. So thank you for your work, and thank you for the work that you brought together, and thank you, Admiral, for explaining it so quickly. Let me just go back to the way laboratory work is done in the United States. I think all of you know, when you go to your doctor and you need a lab test, it is either done in your doctor's office or it's done in the lab that they send you to. When we started this emergency response to this virus, we started with what we knew, and that was the flu platform that we used for surveillance. It wasn't set up in your doctor's office. It wasn't set up in our hospital laboratories. It was set up in state and local labs and at the CDC. Over the last 2 weeks, we've been working with the groups that have served you for decades. The commercial laboratories that you don't see, but your specimen goes to ensure they had the full capacity to meet the needs of the American people. Because it wasn't going to be 50 to 100 to 1,000 tests. It was going to be tens of thousands of tests that would be needed to be done. And so the last 2 weeks has been spent on really getting what you are used to, the full force of the clinical laboratories in service. At the same time, what you heard described here is how do we serve the needs of the people in the community, where they reside, where we know when we're talking about people with vulnerable conditions, immunosuppression, medical conditions, or the elderly, that we don't want them having to